unexpected death, and that's code name for this person overdosed.
Families, like I said, take on that responsibility, like, this could have been my fault. What are people gonna think? What are people gonna say? From my experience, what the average substance use user looks like. The kid next door that is wearing gray Lululemon shorts and a normal t-shirt. He's the clean-cut, nice kid. Usually, parents can't understand why can't they just stop? Why? We're giving them everything. And what they don't understand is that addiction is a disease and that it hijacks the brain.
But so let me pick your brain on this. Marijuana, gateway drug or no?
Gateway drug.
I don't want to take an antidepressant pill. I'll just smoke or have some edibles. It sounds very cute.
I've assessed hundreds of people over the years. And I can tell you each and every single one of them started off with marijuana.
Okay, let's say someone's listening to this and they have a drug issue. What's the best plan of action for those people?
You don't have to be that person that's in a casket and has their mother over them grieving.
Can you tell me a story of when one of your patients passed?
I have goosebumps talking about it.
Before we start today's episode, I just wanted to thank you for taking the time out of your day and giving this podcast to listen. And I also wanted to remind you that the only way this podcast will ever grow is with your support and with your help. So subscribe to the podcast, like this video, and now let's get the show started.
Welcome aboard Middle East Airlines.
والمتوجهة إلى
طيران الشرق الأوسط يرحب
مدينة القدس العربية.
Hi Batool, how are you? Good. Thank you for coming. Batool, I like to start this off with you self-introducing yourself.
Okay.
A self-reflective introduction before we get into the professional introduction. So when you look in the mirror, who is Batool to Batool?
It's a very good question. So when I look in the mirror, Batool is a person who is very resilient. Batool is a person who has overcome a lot of adversity. Batool is a mother, she's a daughter, she's a sister, a community member, and that's what I see when I look in the mirror.
What? You kind of paused there.
I'm trying to find the words. To a lot of people, I am a beacon of hope. And that is a privilege for me, and it truly humbles me every single day.
It's a good thing being a beacon of hope for other people. I think if you would ask the general public what they would like to be, you'll get a lot of like, oh, I want to influence these people, or I want to help. You hear the word help a lot. And I think when people have hope, in a way they do have help, right? That is their help, that lifeline that you throw them. But explain to me more, and this is where you'll go into a little bit of the professional side of what do you do?
Sure. So around the age of 28, I decided to pursue a higher level of education. At that time, I had started off with 0 college credits. However, I had this passion within me to help people within my community. And I wanted to help a very specific population. I wanted to help a population that I felt was isolated, shunned, misunderstood. And I also wanted to focus in on a population that was very stigmatized and in many ways isolated.
Okay.
And so when I was gathering research at the time, I came across the addiction studies program at the University of Detroit. And because I had watched addiction impact several members of my family, I was like, this is it. This is the population that I want to serve.
That's where it stuck with you.
And it stuck with me, and it was the best decision I could have ever made.
Now, we'll backtrack a little bit, because while you were introducing yourself, you said that you're resilient. You've gone through a lot of adversity. What made you that resilient? What is that adversity because you're a clinical psychologist as well. So
Sure.
I minored in psychology and I'm really interested in psychology. So I'm always reading. And most of the times when you want to know why a person is doing what they're doing, you'll go and search up in the childhood or the early years of their life what happened. So for you, what was that?
That's a very good question. And so throughout my life, for about a decade of my life, I went through a lot of adversity. And alhamdulillah, I was able to overcome it. My adversity had nothing to do with substance use. However, my adversity had a lot to do with domestic violence. And at the time, a lot of people within my circle had a hard time understanding, why does she keep going back? And I wanted, like I said, when I pursued a higher level of education, I wanted to help a population that was isolated, misunderstood, where people were kind of like, well, why do they keep doing that? And so when I was researching programs, I was like, why do people keep going back to a drug when it's essentially destroying them and destroying everyone else around them? And in many ways, I correlated it to my own experience.
It resonated.
Yes. And domestic violence is something that is very near and dear to my heart. However, it's something that triggers me. And I just did not want to work in that realm. And so I wanted to specialize in something that was similar, but different.
1 in 3 adults report not getting enough rest or sleep every single day. One of the reasons why that happens is they simply don't know. You think you're getting 7 hours of sleep when you're probably getting between 5 and 6. And how much of your sleep actually helped you recover? I struggled with my sleep for a very long time until I started wearing Whoop. With detailed analytics of how much sleep did I have, how many hours did I spend in my deep sleep or light sleep, to how well my body is recovered. Take control of your sleep and try Whoop out for yourself. Go to join.whoop.com/notfromhere and try it out for a month for free. And now, back to the episode. You work in substance use, and it's kind of not very popular to talk about, especially in the Arab community, because no one wants to admit that their child is going through that, right? And you hear the term unexpected death, and that's code name for this person overdosed. What's happening on the back end in the therapy rooms, in the institutions?
So on the back end of things, are you talking treatment-wise?
Yes.
Okay.
So or I don't even know if you can call it treatment. It's more of you get introduced. So the parent maybe calls you and tells you, hey, my son has a problem. They're not in treatment yet. But what's happening in those conversations, the build-up? Because I'm pretty sure you've had people that you know that have overdosed.
Absolutely. Unfortunately, I have. And so typically how this plays out is usually when parents reach out to me, the addiction is pretty bad. Very rarely do parents reach out to me when the addiction is in its infancy stage. Why? Because typically parents think that maybe it's a phase or it's something they'll grow out of, or they simply deny that their child has a substance use disorder. And by the time I'm involved or other professionals are involved, usually the addiction is in its later stages, which makes it very, very difficult to treat.
If you had caught it in the beginning phases, if a woman just figured out that her son just started taking drugs, what would be the plan of action for something in the earlier stages?
Sure. So in the earlier stages, I always suggest that a professional get involved, because usually what we see is parents try to become the professional, they try to handle the situation, but because addiction is such a sensitive illness, oftentimes emotions are involved. And so parents become emotional, the person that is involved becomes emotional. And so I always suggest that a professional gets involved and then treats the individual that is suffering with a substance use disorder.
How do parents try to get involved and fix it themselves?
So what they usually do is they'll take things away from their child. They'll take the car away. They'll take the money away. If they're employed for the family, they're like, oh, you can't work until you get it, until you're clean. It's that type of thing. Or if you get clean, I'll give you this. If you stop using, you'll get this. And what we see really, and in a lot of cultures, and this is not specific to the Arab American culture, is that it's very hard for families to grasp that this is an illness. Like, how is this an illness when my son or daughter decided to take something? And so that piece is very difficult, and parents oftentimes will take on the responsibility of like, I must have done something wrong.
What do you think about deeming the term unexpected death to where, to saying that my son overdosed?
So I have seen families come forward and get up and speak at mosques and say, my brother, my son, this is why they died and this is how they died. However, it's very rare. And it's very rare because families, like I said, take on that responsibility, like, this could have been my fault, or, what are people going to think? What are people going to say? And so it's just much easier for people to say, it was just something sudden.
I understand it because, okay, see how using drugs, and let's talk about the Arab community a little bit. Majority Muslim, it's a sin, right? And I get it. Why would a mom go out and say the last thing that my son did while he was alive is this thing? But at the same time, you kind of need that awareness, because if you just throw that under the rug, how are other people going to know that it's a problem? And from what you're seeing, how big of a problem is it in the Arab community, at least?
It's a big problem. It's everywhere. And what I see is that people in our community don't want to talk about it because it comes with so much moral weight. Like, these people are bad people. Their child. Yeah, their child is a bad child. And
they didn't know how to raise him.
They didn't know how. Yeah, they take on so much responsibility, and it's very, very difficult. And in many ways, I can understand why people don't want to come out and talk about it. However, the longer we ignore the issue, the longer that we decide to not talk about it, the more other people are going to be discouraged from talking about it. It won't become something that is normalized within our community. And so it'll always be a topic that is shunned, ignored, and not talked about. And how do we overcome instances like this is through education, through advocacy, through people saying, well, this person came out and they struggled with this. I'm not alone. The more that people come out and they say, I'm struggling with this, then people recognize that, like, okay, I'm not the only family going through this. And maybe it's not something that I did wrong, because other people are struggling with it too.
A perspective that I never thought of personally was when someone gets addicted, it takes maybe, especially with hard drugs, it takes you to do the mistake one time, and everyone does mistakes. So if the nature of this mistake was this addictive, and maybe they were peer pressured into it, maybe whatever happened, whatever they thought the consequences was going to be, definitely wasn't taking it for the first time, being like, I really want to be addicted to cocaine right now, right? Yep. So it was a mistake that one time, and now they have to pay pay for it for the rest of their life, you know? Like the 50th time they take it isn't their fault. They're addicted, you know? So that kind of changed my perspective, and how I personally look at it is to where, yeah, he's really not doing it because he's having fun. It's kind of out of his hands at one point, you know? And everyone makes a mistake. You can't speak in a manner to where he shouldn't have taken it the first time. Well, yeah, of course, but everyone does mistakes, and the nature of this mistake came with very high consequences.
For sure. We also cannot dismiss the fact that, because I see this every single day, and every time I see it, it's just mind-blowing to me. I was called to an intervention last week at someone's home, and the young man was 21 years old. And when I sat down with him and started talking to him, I obviously was exploring how did this start? And this is very, very common. And this is a piece that parents really need to be educated on and need to become vigilant of. And it is, I had surgery and I was prescribed painkillers. I had a sports injury and I was prescribed painkillers. I had my wisdom teeth removed and I was prescribed painkillers. And so family members, my son was discharged from the hospital. In this case, this individual was sent home with Percocet. They were prescribed the meds for a few months, and then they were cut off. Percocet is a very strong opioid, and this individual is only in his early 20s. So we know that the brain, typically for males, does not complete maturation until the age of 26. So his brain hasn't really even fully developed. However, this young person is being prescribed a highly addictive, mind-altering substance. And so what happens now? I need the medication or I'm going to get really sick.
Yeah.
And so young people turn to the streets. And when they turn to the streets, oftentimes they are purchasing pills that are created in labs or in someone's basement, and they could be laced with fentanyl, and then we see overdoses. People die.
I want to talk about fentanyl a little later on, but the thing is, like you said, these are like, take the regular person and you tell them this person's addicted to drugs, and then you tell them, paint a picture of what that person looks like in their head, and they probably, the picture that they come up with is someone ripped clothes, sitting in the middle of the street, all tattooed, maybe very dirty, with needles around him. Like, that's the average's person's kind of visual of someone like that. But now you see these people with families that are passing away. They're very young, college athletes, like you said. And then it kind of changes to where these are regular people with families and people that love them, you know? Absolutely. This isn't someone that thought he was depressed, went and took some drugs, got addicted to it, didn't have any support behind him, and then passed away. It's, no, this guy has a lot of friends and family and people that are going to be there for him.
So I'm going to tell you from my experience what the average substance use user looks like in Dearborn. They look like the kid next door. And I actually created a post on this one time, and the post said, the person that is using drugs typically looks like the kid next door that is wearing gray Lululemon shorts and a normal t-shirt. He's the clean-cut, nice kid. That is what the current drug user looks like. So this tattoos and the needles and they're dirty and they're homeless and they're criminals. No. So addiction, of course, touches upon each and every single community, whether people are wealthy, whether they have tons of resources, whether they are religious, whether they have all the support in the world and have absolutely zero risk factors, because I see it. It touches all of us and it does not discriminate. And most recently, the individual that is using drugs nowadays, they look like me and they look like you.
How much of that are you seeing?
I see it every day, every single day.
You said that they call you for intervention. What does that mean?
So what that means is a family will call me and they'll say, my son or daughter is struggling with substance use and they won't accept help from us. So as a professional, they ask me to intervene. And so my services are very different because a lot of my services are on site where I go to the family or the person that is struggling.
And that's why you said you went to the house. And
Yes.
We talked about a little bit about parents and how they react and how much guilt they feel. And maybe a mom won't go and tell her sister that I feel bad because my son got addicted. But if she already reached out to you, you stop being a therapist for the kid. And now you have to deal with the mom, kind of do therapy for the mom because the mom is going crazy and she's very nervous and, oh my God, what's going to happen to my kids? So how do you what kind of approach do you take for the parent that's going through this?
That's a very good question. So my role becomes to educate the parents. First of all, usually parents can't understand why can't they just stop? Like, why? We're giving them everything. Like, I don't understand. Like, what more could we do? And what they don't understand is that addiction is a disease and that it hijacks the brain. And when someone becomes addicted to a substance, their brain needs the drug before food and water. That's why oftentimes you'll notice when someone is using a drug, they become very thin. And
True.
them maintaining the substance is more important than drinking water or eating food. And so educating parents on the very basics that this isn't something that we can just give stuff and make it go away. I want you to think of it as my son has high blood pressure. My son or daughter have diabetes. This is something we need to treat over a period of time because addiction is chronic. What is chronic? It's long term. Addiction is relapsing. What is relapsing? It's going to come back. And so I educate the parents and I answer any questions they may have. Sometimes we're, faced with denial, but sometimes we're like, yeah, you know what you're saying, yeah, we are saying these things.
Yeah.
And so I also work on parents with setting boundaries and not enabling. So parents that deal with drug addiction become extremely overwhelmed, and it is something that burns them out to their core. And so oftentimes what we'll see is family members just will stop fighting. Like, hey, mom, give me $20. They'll just give them $20. They don't want to deal with them anymore. It's exhausting. Yeah. And I'm not saying it from a place of judgment, but people become exhausted.
Or do you get instances where they don't want anything to do with the child anymore?
Sometimes.
Like, لا ابني ولا بعرفك.
Very rarely in our culture.
Oh, really?
Yes.
Okay. That's
Very
good.
rarely in our culture. You would be surprised. Arab Muslim parents will go above and beyond for their children. They truly will. And it's just getting them to understand that this is an illness and teaching them how to work with their child and how to not enable the disease and how to set boundaries with that individual, even though that person is their child.
How do you guide them to deal with the child? So let's say she calls you, she tells you, hey, my son's going through 1, 2, 3. I don't know how to deal with him. How are they supposed to deal with them?
So usually it depends on where the addiction is at. So can you elaborate a little bit more?
Okay, this came from something I saw you post one time, and it's the mom was happy because you taught her or showed her how to guide her kid and how to kind of deal with him. And I was curious to I wonder how the mom was dealing with him before and what Batool told her that really helped her.
Sure. So It goes back to like the education piece and the enabling piece. And oftentimes, once I intervene, I tell the family members to learn how to set those boundaries and then redirect the person to me. So I become the person that is handling a lot of the issues that are going on with their child so that they don't have to deal with it, because it becomes very, very challenging for them.
Do you ever feel that weight and responsibility that, oh, this is in my hands now, and if he gets better, okay, I did something good, but if he gets worse, did I do anything wrong? Is there anything I could have done better? And especially with these kinds of things, it's the consequences are very harsh, you know?
Oh, yeah.
Like, you can be talking to your client one day, and then next day they're not there anymore. How much of that weight do you put on your shoulders when it comes to that stuff?
It's a very good question. And unfortunately, I have had a lot of clients that have passed. And if you know anything about addiction, you know that the success rates are very, very slim. And so the first thing that I do when I meet with family is that I tell them I'm not a miracle worker. I tell them that there is no amount of money that you can pay me that I can just cure your child. I wish. If I could, I would do it for free. But this is a disease, and it is the leading cause of death in the United States. More people die from drug addiction than guns, car accidents, and suicide. And I'm very real with people. And I tell them that this is a condition that I can't cure, a doctor cannot cure, no one can cure, but we can treat it. So addiction is treatable, addiction is not curable. And so right off the rip, I take that responsibility off of myself, and I'm very real with myself and with the people that I'm working with. So that's the approach that I use.
Can you tell me a story of when one of your patients passed, without obviously naming? Or
Okay, so obviously over the years I've worked with a number of community members, but one case was very near and dear to my heart because of the child was an only child, and he was very young. And I had worked with this young man for a few years. So let's just say that I met him in 2020.
how old was he?
God, I would say maybe 19.
Okay.
And I sent him, he and his mom came to my office at the time, and I talked to mom. Then I asked her to step out. I talked to him. And based on my assessment, he needed to go to treatment. And he was like, I don't want to do this anymore. You know, I'm putting myself through hell. I'm putting my mother through hell. I'm her only child. I feel like complete shit. I don't want to do this anymore.
Arab?
Yeah.
Okay.
And I was like, okay, good. So I connected him with the proper resource for him to seek out services based on his drug addiction. And so he went in to treatment, completed the 21 days, came back out. Mom sent him to another state to live with a family member for a few years.
How come though?
To remove him from his friends.
Okay.
To just get him away, which I thought was an excellent idea.
Okay.
And I was very happy that he was open to it at the time, because that indicated to me that he was invested in his recovery.
Yeah.
And so maybe 2 years passed by, and mom contacts me again, and she's like, I just want to let you know, like, he's back. And so returns back to Michigan, and 2 weeks later, I get a phone call. And, it's a mom who's in complete panic. And she's like, my son is in ICU, and he overdosed. And so I asked her, I'm like, okay, where, whatever. And she tells me what hospital he's at. By the time I arrived and she had already been there. He was up in ICU. And doctors came out and told Mom that the probability of him making it were very, very slim, because what he had used were pills that were laced with fentanyl, and he had basically become brain dead. And that if he were to live, he would live in a vegetative state for the rest of his life. And that they were going to wait to run a few exams to see if there were any brain activity, anything. And unfortunately, there was nothing. And so they had to pull the plug on him. But when they conducted toxicology, he had taken 2 pills, 1 Percocet and 1 Xanax. So I often like to remind people that an overdose is not 100 pills at a time. An overdose can literally be 1 pill, 1 time. And that could be it. And I have goosebumps talking about it. I mean, that was an experience that will never leave my mind. And it brings the realness of addiction to the forefront of it could only take just 1 pill.
What made it near and dear to your heart?
I'm a mother. He was her only child. He was young. He was an amazing young man, so respectful, kind. He always greeted me with a smile. I knew how much he loved his mother, and I knew how much she loved him, and it just broke my heart to witness the outcome.
Is there a conversation that you had with him that was memorable?
I remember him telling me why he wanted to get clean and how he wanted to make his mother proud. And like I said, they had a lot of love for each other. And this young man was not a young man covered in tattoos. He was someone you pass at Greenland. He was someone that, probably worked at like a local restaurant or something. He was someone that, looks very much like a normal 20-year-old kid and was extremely respectful. And so everything about him still kind of, leaves like a little trace of him within me. Just his gentleness, his kindness, his love for his mother.
When you go back, when you hear this news and now you're sitting in an empty room by yourself, what are kind of the thoughts that are going through your head? What are you thinking after knowing a person that was so kind, gentle, respectful, that you worked with closely, passed away? What's going through your head?
Well, what goes through my head is that, it can happen to anyone, and that really this doesn't discriminate, and that no one's safe. It doesn't matter how well raised you are. It doesn't matter how religious you are. It does not matter how educated you are. No one is safe.
What does the mother tell you in that situation? Because you're the closest person that was working with her son.
When she seen me, she just literally collapsed in my arms. And whenever I do see her, it's the same thing. And it's very difficult. It's very difficult. But the mother was well aware that her son had a drug addiction, and she was not in denial. She understood very clearly what had happened to her son.
Do you feel guilty?
No.
No guilt.
I never feel guilty because I'm very honest with people from the beginning, and I know that this isn't something I can make go away. I understand that this is a disease. I understand the monster that I'm working with.
It's amusing to me that you would go into a field where you know the chances of success are very, very slim. You know you're going to be faced with death more than you can ever imagine. You know that you're going to deal with collapsed families, with broken hearts. Like you understand all of this going through it, but you're like, all right, 2% chance, I'll take it. Let's start work. You know what I mean?
So, although I do encounter some very heartbreaking situations, I also see that people can come out of it.
Tell me about a story. Let's lighten up the mood a little bit.
Okay, so I met a 20-year-old man last year, and he had been struggling with substance use for quite a few years. He started dabbling with substances early on as a teenager. And when I met him, he had just kind of like come back from an overdose. So
is this considered late stage?
yes.
Okay.
Yes. And so I went to the parents' home. I met with him, and I gathered the information. I understood that he had been to a few treatment centers in Michigan, but usually he'd go back to the same place, same environment, same friends, and very shortly after that, it was just a matter of time before he would go back to using the drugs. And so because he had had a history of seizures, a few overdoses, I immediately, in my mind went from like intervening to keeping this person alive.
You just wanted him to survive.
And so I talked to him and I said, we've tried, not we, but you and your family have tried a few things locally, and it seems like they haven't worked for you. And he was like, no. And I was like, well, I know of a program, but it's not in the state of Michigan. It's in another state. And almost, I would say 8 out of 10 people that I've sent over there have seen really good results. Would you be open to the idea of seeking treatment outside of the state of Michigan? And he said yes. And when he said yes, when I tell you that everything, like his assessment, his appointment to the treatment center, his airplane ticket, everything was booked in a few hours, I'm not kidding. Like the mom was crying. She's like this is happening so fast. And a lot of people are alarmed because I act so fast, but I act quickly because it's life or death. And I know that all it could take is that person using one more time, and that's all it could take.
Yeah, and you pick up on the momentum. If he said yes, that means in that moment he is willing to go. So let's go.
Yeah. And so the very next morning at 7 a.m., he was off. He was in California for about 7 months. He came back to Michigan. And when he came back to Michigan, of course, he was on medication and to make sure that he doesn't relapse. Because for opioid use disorder, people can get on a medication that can act as a barrier between them and the drugs. Okay. So if they use the drugs, they go into withdrawal, they get sick.
Yeah.
And so I had recommended that he start that medication, and he did. And he's been on that medication now for 5 months here. He is fully functional. He lives on his own again. He goes to work. He goes to the gym, has a great relationship with his parents. And I meet with him every single week. And, situations like that, they give me hope. I go and I sit with him and his parents at their home. And, they're so grateful.
Yeah.
They're like, do you understand that, we couldn't even get him to sit with us? Everything, we were always fighting over something. That was not our son. And it's very heartwarming to see that parents get to, in a sense, have their child back and sleep peacefully. So,
how much does something like that cost, going to California for 7 months?
Very good question. So this specific family had very good health insurance.
Mm.
And from what I understand, the first 6 months or maybe the first 5 months of his treatment were covered by insurance.
Oh, okay.
Yep. After that, I believe the family was paying somewhere around $5,000 a month
Okay.
for his aftercare, that what we call sober living. It's where he lived in a home with people who are in recovery, and they basically teach people in recovery how to live functional lives without drugs and or alcohol.
Yeah.
And so it's a very, very slow reintegration back into society, and it's very recovery focused.
So when you go into recovery, they tell you no drugs at all. So it's not like they're in recovery to stop using Percocet. You can't use alcohol,
Yeah.
no marijuana, none of that.
Yeah, nothing. And sometimes what we do see is, okay, well, I'm not going to use opiates, but like I could drink on the weekends. And it's like, no, you can't. And that is something that I worked with one of my clients. And after over 6 months of clean time, I remember he and I talking, and he said, Batool, I recognize that I'm an addict, and there's no substance that I can use successfully because I don't know when to stop. And so sometimes we see people, they become very conscious of their life and active addiction.
Yeah.
And they accept that they have this illness. But sometimes, people simply don't make it out. And
But so let me pick your brain on this. Marijuana, gateway drug or no?
gateway drug.
You think so?
Absolutely.
I believe it is too. What's the philosophy on the other side, to where marijuana's a soft drug? It's okay to smoke once in a while. It has some kind of benefit. I was reading research that, especially for young teens, you say, let's say 16 till when their brain fully develops, 25, 26, using marijuana twice a week had them experience mental health issues later on in life.
Absolutely.
More than twice a week, we start seeing psychosis, schizophrenia, bipolar, like the real heavy hitter stuff of mental disorders.
Yep.
So, but what's the philosophy on the other side of the data so clear on marijuana?
As a gateway or not?
As a gateway. Why do they say it's not a gateway?
So you'll notice that those that are very pro-marijuana or that advocate that marijuana is not a gateway drug are usually influenced by some type of financial gain. So I'm going to tell you from my own experience.
Please.
So I've assessed hundreds of people over the years. And I can tell you that each and every single one of them started off with marijuana. Like, this is documented. These are assessments. And what I hear from my clients, and they tell me, is, I was 13, I started using marijuana, and then gradually I found myself hanging around people that have substances. One thing led to another, and one drug led to another. And usually that's how it goes.
You might be upset with me when I'm about to say this, but depression, okay? A lot of the use for marijuana, or the light use for marijuana, is, I have problems going on in my life. I'm depressed. Let me use marijuana just to alleviate that pain and forget a little bit. And then whatever. And then it escalates. It starts becoming something else. We have a problem, I think, in dealing with depression, I don't want to say it's not a thing. I don't want to say I don't believe in depression, but I think that over 90% of the depression that we see in our day-to-day life can be cured with stuff other than antidepressants and stuff other than marijuana, because the philosophy is, I don't want to take I don't want to take an antidepressant pill. I'll just smoke or have some edibles, very soft. It sounds very cute, we'll just smoke once a week with my friends. We'll have fun. And I'll do that without taking the antidepressant. Okay. But that's leading him to the heavy hitter stuff. right?
So science tells us, now I'm talking about teenagers. There are three main avenues that teenagers start to use substances. The first one is they get injuries from like sports. The second one is self-medication. So they're depressed, they're anxious, and so they become influenced by this idea that if I smoke some weed, I feel better. But what they don't understand is that marijuana is a addictive substance. Cannabis use disorder is a classified disorder. It is something that we diagnose people with. And
How much marijuana does it take to classify them?
okay, good question. So if someone is officially diagnosed with cannabis use disorder, if they are experiencing withdrawal, so I don't use the substance, I get sick. I become angry. I get irritable. I get anxiety. I experience changes in my mood. I experience changes in my appetite. I experience changes in my sleep. And then also we look for over a period of time, you started using this much, but how much are you using now? Have you built tolerance? And then is the substance getting in the way of your ability to function? Is it getting in the way of your relationships, your education, your job? How much dysfunction is it causing? And usually we see that it is causing dysfunction. Especially in interpersonal relationships. You know, if people are used to smoking marijuana to calm down and they stop smoking, they're not calm anymore. And now they're experiencing anxiety and mood changes because of withdrawal, which amplifies those symptoms.
Yeah. So
What
now it
now?
kind of worked against him or her.
Absolutely.
Okay, and with dealing with depression, what's kind of your philosophy on it? How would you kind of go about it? Because I like having this conversation because I think there's a way to do it without any substance
Okay.
most of the time.
So, good question. One time I had a conversation with a psychiatrist specifically about depression and medication. And I said, you know, I don't really know how to feel about this. I am majoring in addiction studies. I'm very anti-opioids, anti-benzos. Why should I not be anti-antidepressants? And he looked at me and he laughed and he said, I'm going to ask you a simple question. And then the answer will be right in front of you. I said, okay. And he said, do you see any drug dealers selling antidepressants? And I was like, no. And he was like, okay. Antidepressants are medications that are used to treat a chemical imbalance that a person is experiencing. They are not drugs. They don't work instantly and alter your mood and alter your thought process. And I was like, okay, that makes sense. And so that changed the way I viewed antidepressants. I've also seen them work. People who used to use drugs to deal with their depression now are on Wellbutrin or they're on Prozac and they're functional and they're not drug seeking. But studies do show that exercising for over 40 minutes for at least 3 times a week is just as effective as Prozac.
That's kind of the stuff I'm looking into more. It's I was in a part of my life where I thought that, oh, I'm upset, I'm sad, and just the typical depression talk. When I say depression, I'm talking about the mainstream depression that people talk about. And then after working out and getting to the gym, instantly, none of that. And then maybe there's a problem with diagnosing depression. You said there's a chemical imbalance in the brain. How many times has depression been diagnosed without seeing what the chemical reactions in the brain are?
Yep. Which, you know, I had a professor and she talked about this and she said, you know, you guys are going to be questioned a lot about your diagnosis of depression. Why? Because we can't just take some blood and measure it. It's a cluster of symptoms and it's very subjective, right? We can't measure it. And so I hear that often, but like as a professional, I truly believe that like depression is a condition and it is something that people truly, truly struggle with. And oftentimes we see people diagnosed with depression and there's no reason, like nothing is going wrong in their life. Sometimes depression can be a genetic vulnerability. And so that's usually what I like to rule out is first I ask my patients to go to their PCP and get a thorough exam done. So they check their thyroid, they check different types of minerals, check if there are any deficiencies, and then if everything comes clear from there, I move on with my assessment.
What's the majority of what you see?
In regards to depression. Yeah.
And the PCP results. Like, what is it most of the time?
So it's usually mostly correlated with people's it's hyperthyroidism or hypothyroidism.
Can you explain a little bit for people that don't know how the thyroid is affecting all of this?
If the thyroid is not functioning properly, it can affect the chemicals in the brain that have to do with your mood.
So from what you're seeing, most of the time, it's a thyroid problem.
It can be.
Okay.
It can be.
Okay.
Sometimes it's environmental. Sometimes it's, something that just comes on as a condition like any other condition.
And then if they treat the thyroid in those times, it just goes away?
Yeah.
Fentanyl, you brought it up multiple times. And I thought that it was widely known what fentanyl does. But then having conversations between my friends or colleagues, it's not as common like most people don't know what fentanyl does. So you're an expert. So can you shed some knowledge on what fentanyl is and what it does?
Sure. So fentanyl is a very, very strong opioid. If it is administered, it's usually administered in like hospitals under the care of professionals. But in the case of like overdoses and what we see and people dying of fentanyl overdoses is that people are mixing fentanyl into drugs. And when I say people, these are drug dealers. They don't care about safety.
Yeah.
And so just a grain of salt can kill you. Like
grain of salt.
Yes.
Amount of
fentanyl can kill you. And like, I don't know if you've seen before on the news, like sometimes cops are searching a car.
Yes.
And it just touches their hand. And then some make it, some don't. And so when these drugs are being created in labs and they're being created in basements somewhere by people who, quite frankly, don't care, you just never know. You just don't know what's going to get mixed into what. And then they get pressed and then they're distributed. And like I said, all it takes is just a little like grain of salt. It'll kill you.
I just have out of curiosity, let's say a drug dealer is putting fentanyl in the product. Doesn't the drug dealer look at it as from a business perspective, just wants a return client? So what's the philosophy behind the drug dealer knows that a grain of salt of fentanyl is going to kill this client and then he's not going to be a return client. So what's the point in putting this fentanyl?
Excellent. So there's this hypothesis that because of a lot of the drugs are made in China and in Mexico, that this could be a form of terrorism.
Okay.
And that it's done intentionally to kill Americans. That's like one hypothesis. But I'm not really sure, like, what the logic is behind that. Some people say that, like, when it's mixed, it's stronger. It's like a better, the high from it is different. But I don't really understand the rationale. But a lot of people are, I don't know how much you watch, like, Fox News and stuff, but they're always saying that, like, oh, the Chinese are sending in drugs and the Mexicans are sending in drugs. And you can't help but wonder, like, how much of that is true.
I asked a question to a specialist one time, and the answer back was interesting. And he said, drug dealers, will sometimes, let's say, someone does not pay, or of course, a lot of the people that do drugs have major financial issues.
Oh, yeah.
So if the person does not pay, these people don't care. You either get your money or they don't want you. So they'll put extra fentanyl to get rid of the person. That's one thing. And another thing is that you see how there's a reputation. Like, you have your reputation, I have my reputation. And he's like, this this drug dealer puts more fentanyl, and if it kills a person, the reputation of the drug dealer is he has the good stuff. So the word across the street starts spreading, like, hey, X has the good stuff, let's buy from him. And that was kind of another rationale. But I was just curious to see what you had to say about it.
I mean, it could be. I've heard like my clients talk about different dealers, and that this dealer's stuff were not good, and this guy had the good stuff, whatever that means.
Yeah.
So, I mean, it could be. I guess that for some people, where they buy their drugs from hits differently. So that might be it, but it's interesting with people that purchase drugs and their dealer, because they really trust their dealers.
Yeah.
And if I have someone that is actively using, and like my main goal is harm reduction at that point, I'm trying to reduce the harm, I'm trying to keep this person alive, and they'll always say, Batool, my drug dealer is, no, man, like, you don't, no, he's good, his stuff's good. I'm like, how do you know that? But do you know how many people have touched the product before it got to him? Yeah, but he knows, like, and I'm like, but they're convinced. And it blows my mind. But it's a part of the psychology of addiction and the illness.
Yeah. Let's say my friend takes drugs. He's in the cycle, and he's bad in the cycle. He has not told me that he does drugs, but I know. What are the steps that I should take to help them? Because everyone says the way to go about the drug issue that we have in our communities is, let's talk about it. Let's talk about it. Sure, we're talking about it right now, but I'm tending more to think of on the ground solution. If I know my friend is doing drugs, how do I approach a solution to that?
Sure. So if you have someone that you know that is currently using substances, what you can do is, or what I suggest that you do, is plant the seed. You can say something around the effects of, I can see that you're struggling with something. I don't really know what it is, but if you ever feel like you need some support, or you just need someone to talk to, like, you can always talk to me. Like, I'm not going to judge you. And if I can help, I can try to guide you. Or if I can't help, I can try to guide you to someone who can. So usually what we suggest is just planting the seed. And I always recommend that we are very cautious with the words that we use. So if you're suspecting that someone has a drug addiction, I don't recommend that you say, hey, I think you're struggling with addiction, because that'll either like
put him in denial right away.
Yep. And then he'll start like, no, what's wrong with you? Whatever. So choosing your words cautiously.
Okay.
So I use support. Like, that is one of my favorite words to use. Even when I talk to parents, sometimes I say, if I tell them your son or daughter needs therapy, they're like, therapy? No, or they're not crazy. But if I say, like, Khalto, your son or daughter, they can use some support. Yeah, of course, Khalto, no problem. And so use the words wisely. Plant the seed, and plant it where you're coming from a place of concern, but at the same time, you're being empathetic about it.
Yes. Okay.
And what you'll find is that even if they do not admit or accept the help at that moment in time, in their mind, they know that they can come to you when they are ready, because you placed it in their mind, and you did it in a way that's not judgmental, that's giving them control over their own treatment. You're not telling them what to do, and you're saying it in a way
To where I'm here for you.
Yes.
Yeah.
Yes. And it's hard. And, if that doesn't work and you see someone spiraling out of control, then that's when like an intervention would be a good idea. That's when professionals intervene.
The hard thing about that, when I think about it, is if my friend is actually doing drugs and I'm scared for them because I don't know. You said it multiple times. You don't know if that next pill is going to take them out. It's, am I really going to be patient and tell them, hey, whenever you need support, and me in the back of my head, I know if he goes home that night and takes a pill, he might not wake up in the morning, So it's very difficult to be like, yeah, let me just throw these words out there, and maybe one day he comes, and there might not be a day that, what's it called?
Yeah, I understand that. But at the same time, if someone's not willing to get help, no matter what you say
There's
or how
no
you
way.
approach it, it's not going to work.
Okay, let's say someone's listening to this and they have a drug issue, and let's say it's marijuana, or like from the softest drug to the hardest drug, and they're listening to this. They haven't told anyone. No one knows. They really want to change their life. What would you tell them as a specialist? The stuff that you've seen the people that have died, that have overdosed, and you've seen the people that have recovered. What's the best plan of action for those people that are kind of in the shadows right now and they don't want anyone to know? And there's no way they'll tell anyone.
Okay. So for those that are currently struggling with substance use disorder, what I would like to emphasize is that this is life or death. And that a person does not have to live and suffer the way that they are living and suffering through active addiction, because it is not easy to live when you are addicted to a substance. Your life is literal misery, and everyone around you is experiencing the same misery that you are. And so I would encourage that person to reach out to a professional. If they're not comfortable reaching out to family or a friend or someone, but ultimately you want to reach out to a professional, and that treatment options are available and that people do recover. Like the story I shared with you, they're both 21. One made it and one didn't. And so you don't have to be that person that's in a casket and has their mother over them grieving. And, parents are never the same. After they lose a child, they just aren't. And so my message to them is that, there is help, and you don't have to live this way.
What's one thing that we didn't talk about today that you think we should have?
One thing that we did not talk about today that we should have is I encourage parents to talk to their children about drug use before it becomes a problem.
How can they do that?
Okay. So oftentimes what I hear is, I don't want to talk to my kids about drugs because then I'm planting that seed.
I'm opening their eyes to it.
I'm opening their eyes to things that they're oblivious to. And, science tells us that kids know about drugs right around on average, third or fourth grade. They already know. So they have this idea, they hear things, they know that like there's this thing that they could take that'll make them feel really good. And so it's educating your kids and giving them the right tools to use, because it's not if they're going to encounter this situation, it's when are they going to encounter it and how ready are they for it. And so I always encourage parents to have an open line of dialogue with their children and not, think that like, okay, if I talk to my kids about drug use, then I'm making them aware that there's drugs and they're going to go seek it out. And it's like, no, this opens a line of communication. And oftentimes, like, especially teenagers, they're put in situations that they don't know how to handle. And who do they usually turn to? Their friends. And sometimes their friends make horrible decisions. So just letting them know that like they can come to you if these things take place so you can guide them. So that is something that we did not talk about that I would like
People to know.
people to know.
How much does this stuff cost on average? You said in California it costs 5,000. That's post.
Oh, that is sober living. That's
That's
$5,000 for 30 days. Okay, so the first 30 days of treatment are very, very expensive. And on average, if you're going to a treatment center that is well equipped with resources, has a doctor on staff, so on and so forth, you're looking at least $750 a night.
Wow.
Yes.
And how long they have to stay for?
At least 21 days.
What does that come out to?
Probably over like $20,000 a month on average. Yep, that's what I know. It's expensive, and that's why I encourage family members to seek out private insurance, because if you're going to lean on Medicaid and government funded programs, first of all, they don't have space. You get on a wait list. People die on wait lists while they're waiting to get in, and the treatment centers, they don't have the best resources. They don't. And so I always suggest
the government, they don't have, you would expect, I guess, employees probably aren't well paid.
High turnover. Yep. Doctors not always on staff. Might come in maybe once or twice a week.
That's insane. That's not like...
Well, the psychiatrist, at least, the psychiatrist. And then they usually have like nurses administering meds. It's not the best quality of care. And people end up leaving because it's not the best condition to be in.
Paying $20,000 it's not like it's not the best condition. It's like it's not feasible for most people.
Now, if you're paying $20,000, you're getting good care. They have doctors on call 24/7. They have counselors on call. They have nurses. It's a completely different level of care.
It really destroys a family, is my conclusion.
Of course.
Like drug use. Yeah, you're talking about these immigrant families that came to America to survive, to just put their kids in school, you know?
Yep.
And then my kids will figure it out. And then they're working these minimum wage jobs or whatever. And then to help their kids, they have to pay $20,000 a month. And you said very slim margins of success, these things.
Yep. And so I've created, over the years, GoFundMe accounts. The community has come through. Within a matter of days, we had one case where we raised about $18,000 in 3 days. And we sent a gentleman to California. I also have sent a few people to Sober Living, where we created GoFundMe pages because, like you said, their parents are working class Americans. They cannot afford that. And alhamdulillah, I can say to those people, I can confidently say that those people are fully functional now.
What have you seen from the religious institutions in the community when it pertains to drug use? Because like a lot of what you said is knowledge, like even the parents, like you try to educate the parents, and I don't think it's any different for the religious institutions, especially in our community, because people tend to want to look towards God and the religious institutions when something like this happens, because they do think that they need a miracle. And obviously Muslims think that Allah will solve the problem. So we just turn to Allah subhanahu wa ta'ala, which is beautiful. But I think the religious institutions need a lot of education on that. So, but I don't know what they have been doing or not doing when it comes to this stuff.
So what I know is I've reached out to a few institutions, and they were extremely very open, and they recognize that we were trained in Islamic studies. We are not trained to treat mental health conditions or substance use disorder. And so I had a conversation with one of the imams because I was struggling with a family to allow their child to seek out services, because their thought process was that, you know, my child just is not connected to God, and they're being negligent of their prayers and so on and so forth. And so I had to consult with a faith leader to get them to get on board. And so what the faith leader told me was that it is your Islamic obligation to treat mental health conditions, whether it's substance use disorder, whether it's depression, whether it's anxiety, anything like that. That he basically said that that if you do not seek the treatment that you need, that your nefs would hasib you one day because you allowed yourself to suffer when you could have got help.
Yeah.
And this was like a prominent individual in the community. And so we've also worked with, during Ashura, we created a program for 10 days where we had 10 different speakers come up before the Majlis, and they would speak about drug addiction. We had Abdullah Hamoud, we had people from the FBI, we had people in recovery. I spoke, Dr. Shabak spoke. We had an array of speakers. And every single night for the first, right before the Majlis, we had people speak for 10 minutes on drug addiction. We had a resource table outside. And so I believe that like our institutions are trying, but all they can do is give family members resources, and then.
Right.
So, I mean, I believe, you know, they're doing what they can, but then the rest is on the person. Like, I can give you a referral, but.
If the person doesn't want to seek help, like you said, there's no way.
Yep. Yep. And I want to mention that religion is a protective factor. So when I say that, it helps people. Like, a lot of people that I know that have gotten clean really lean on their faith, and they become, you know, religious. They become a part of their community. They go to Hajj. Subhanallah, they lean on their religion as a part of their recovery.
Yeah. It's a good way. Like you said, protective is a very good word to use, because I think it's exactly that. When you turn to religion and you know that God's got your back, let me just put in the effort and the work, and it'll be better. Thank you so much, Batool.
Thank you.
This was very insightful. I really enjoyed it.
Likewise. Thank you so much for having me.
Of course.
Okay.